Hello, good evening everyone. Welcome to our Facebook Live on Nursing Prioritization and Delegation. So it's Thursday again, so we have scheduled you tonight. Very nice questions. We have prepared you 4 questions for tonight. We are going to dissect the questions and explain also the rationale. Now, everybody, welcome. Before anything else, I would like to introduce myself. My name is Mr. Alan Matus, and I am a nurse educator. And I have been a nurse educator for almost 25 years, helping students pass their nurse licensure examination or NCLEX. And also, currently, I am a nursing faculty. I work in a nursing program, and I help students pass their nursing program as well. So, also, if you don't know everyone, I'm also an author. So, I have a book published in Amazon. Okay, so this is a book, everyone. It's also now available in the Philippines. You can get a black and white copy of this book. You can just email matusnursingreviewacademy@gmail.com, and we will answer your inquiry on how to purchase the book. So anybody who has the book, if you can give a quick shout out in the comment section how you're finding the book so far. And at this time, we have a 5-star rating for this book. So it's called Simple, Fast, and Easy NCLEX Review, which means to say that it is not, don't expect that it's going to be really explaining everything. It's just really a simple way of reviewing direct to the point content. And so far, students love it because of the outline of the book. So everybody, that's available in Amazon. Okay? All right. So I'm so happy and glad to be here, everyone. We have several testimonials tonight of students who passed the NCLEX review already, or the NCLEX. But before anything, I would like to give a shout out to some students who came in very early tonight for our session on prioritization and delegation. So we have Leah Aquino Fernandez, we have Gian Torres, who really came over, was really very early, Yoshika Singh also. We have Carrie Ann Gordon, we have Halima Talimi, also Gian, Asa Blanche, also Uche, hi, Galina Nikitenko, and also Mulu Hadera. So, and also if you can indicate from which country are you coming from, or from which state are you from in the United States, okay? But anyway, everyone, before we proceed also, I would like to um, give you the first item in our agenda, which is going to be our testimonial, everyone. So I'm going to read them, okay? All right. So our first testimonial is a student that I had in the 10-day NCLEX review, and this is Jerick. So Jerick says in his message, he said that it's been 10 years since I graduated LV in school. I lost hope till Matus Nursing Review, and let me tell you, it is the best nursing review available. All the resources or materials that you need to help you prepare and pass the NCLEX all in one place. I cannot thank Sir Alan enough. The way he teaches just works. I did his 10-day comprehensive online NCLEX review and passed 2 months after. So do yourself a favor and sign up. You won't regret it. Get that license because you deserve it. So thank you very much, Jerick. And again, congratulations for passing your licensure examination. The fact that that you have been a graduate for a long time, but still you were able to pass your NCLEX the first time. So again, Jerick, congratulations for this great achievement that you have in passing your NCLEX, even after 10 years that you graduated from the nursing program. And also another one, I received this email yesterday, and it's really very nice because Oliga is really very grateful for the success for her success in the NCLEX, being our student in the online NCLEX Academy. So Oliga emailed me and she said, "Good afternoon, Sir Alamatus. It is with utmost gratitude that I'm sending you this message. I want to let you know that I passed my NCLEX-RN examination with 75 questions. I sat for the exam on Monday, but didn't check the result until this afternoon due to fear and anxiety. Yes, because this is my 7th attempt. I'm thanking you, sir, because your review helped a lot. I enrolled in the online NCLEX Academy. Your review made learning easy for me and taught me how to improve on my weakness areas. I learned so much, especially the live prioritization delegation sections every Thursday. God bless you, sir, and He will reward you abundantly for being joy to many repeat test takers. I have started spreading the good news about this review, and I'm using this medium to reach out to someone out there. The delay is not denial. Your time has come, Oliga. Oliga, thank you very much for this very nice testimonial. And I think you're also here in the comment section tonight. So thank you very much. And also, if you can do a Facebook recommendation or review, I would appreciate that as well. So congratulations. And of course, I like the fact that you never gave up, even failing NCLEX several times. And finally, you passed your NCLEX after several or 6 attempts. Okay. So congratulations. And I hope that you will have a flourishing nursing career and really enjoy and find the field that you're very passionate with. So thank you. Anyway, also, I would just like to make a quick announcement. We are scheduled for our 10-day live comprehensive NCLEX review webinar in July 24th to September 25, 2021. That's going to be from 8 to 4 p.m. Saturday class. If you're a long-time graduate or a new nursing graduate and you really want to solidify or strengthen your content, so this is the review for you. So we will go over the basic nursing content, master the nursing content before you take your NCLEX. Of course, I always tell students that it's very important that when they take the NCLEX, they need to have a very strong foundation, really knowing their content. So the review program comes with a workbook and at the same time, the access to our online lectures as well. So if you're interested, just visit our website, matusnursingreview.com, or you can also visit matusnursingreviewacademy.com. Or if you have any information or if you need any more information, you can just email us also at info@matusnursingreview.com. So the website is there, everyone. We're starting again in July 24 to September 25, 2021. That would be a Saturday class. All right. So again, for tonight as well, everybody's excited about this. We're going to have our free 90-day online access NCLEX review. So stay over after the session. We will announce the winner, everyone, if you make a comment in the comment section. So thank you very much. Okay. So for joining us tonight, and we have a lot of success stories of students who have won our raffle. Okay. So our Facebook Live, we usually conduct this every Thursday around 7 to 10 p.m. We usually make an announcement an hour before or 30 minutes before. So just keep posted on Thursday if there is a Facebook Live or not. Okay, so we usually announce on the day itself if there is one. Okay, all right, so just keep posted. All right, so I would just like to share one very nice comment from Diane. She said that she really enjoys the online review. You can just read her comments in the comment section. So without knowing those concepts. So thank you very much, Diane, for your feedback. I really appreciate that. Okay. All right. So another one we have, again, before we start our question proper, I would like to ask you guys if it's possible that you can share this session with other students. And at the same time, if you're watching in YouTube, you can click subscribe so that you can get more video updates. Okay, so share now, everyone. 1, 2, 3. Thank you very much, everybody. Okay, it's very exciting because we are already in the middle of the year of 2021, and so far since the beginning, we already have conducted almost at this time, guys, this is the 59th session. So by next week, it's going to be 60 sessions. So thank you very much, everybody, for your support. And until this time, we're doing this Facebook Live on the Prioritization Delegation. I'm really very happy that it has helped a lot of students free of charge, watching these videos, everybody. So thank you. Okay. So everyone, are you ready for our first question for tonight? We have interesting questions on prioritization. So the first question, everybody, get ready, everyone. And again, if you can put from which country or where's your location tonight, everybody. Okay, so Macon Icon Bancolmo is from UAE. So thank you for being here. Olubunmi Balofim is from Houston, Texas. We have Uchi from Maryland. Vibrant Diane Rose from Florida. Okay, from Oregon is Diane Oliva Bolido. Okay, now, so we have the first prioritization question. So as usual, this is a very common type of question that you will have in the NCLEX, wherein you will be given 4 patients. Okay, so at this time, let's see. Okay, what will be your answer? The nurse receives the following clients after a change of shift report in the medical surgical unit. Which client should be seen first? A. The 44-year-old client who complains of painful leg vesicles due to an outbreak of shingles. B. The 52-year-old client who reports that the new colostomy stoma bleeds after surgery. C. The 36-year-old client with type 2 diabetes mellitus who refused a morning dose of insulin. Or D. The 62-year-old client with dementia who tries to remove the nasogastric tube due to delirium. Okay, so again, the nurse receives the following clients after a change of shift report in the medical surgical unit. So which client should be seen first? A. The 44-year-old client who complains of painful leg vesicles due to an outbreak of shingles. B. The 52-year-old client who reports that the new colostomy stoma slightly bleeds after surgery. C. The 36-year-old client with type 2 diabetes mellitus who refused a morning dose of insulin. Or letter D. The 62-year-old client with dementia who tries to remove the nasogastric tube due to delirium. So Halima Talime is also from New York. Okay? All right, so what do you think is the answer for this question, everyone? What do you think, or who among these four patients is your priority? Okay? Who do you think among these four patients is going to be your priority? And you have to put your rationale as well so that your nurses will know why is it that you picked that answer. Okay? A, B, C, or D. Okay? A, B, C, or D. Who do you think will be the first patient that you need to see in this situation, everyone? Who do you think? And again, when you have these kinds of questions, I know that these are prioritization, but do you know that these questions, at the end of the day, can only be answered correctly if you have good content background. So if you really know your background, everyone, your background information, or your core content, everybody. So who do you think will be the priority in this question? All right. So let's see who's going to be the priority. So everybody put your answer now. Okay, 5, 4, 3, 2, 1. All right, put your final answer now, everyone. Okay. The answer to this question, everyone, is going to be, so what do you think is a very important approach in answering this question? So always remember that you have, is it pain, which is a priority, or is it someone after surgery wherein the stoma is bleeding, or is it someone who is refusing a medication, or is it someone who is trying to remove the nasogastric tube? So the priority in this question, everyone, is letter D, everybody. Okay, so letter D. So for letter D, this is a priority. Your client with dementia who tries to remove the nasogastric tube due to delirium. This is your priority. We have to talk about safety in this situation, everyone. The fact that this patient is having delirium, and we all know that delirium is characterized by hallucination, by confusion. So we need to ensure the safety of this client first. Okay? What if the patient accidentally removes a nasogastric tube? Okay, so that can cause injury. Or what if the patient is trying to get out of bed? So the fact that this patient is having delirium, we all know that safety will be the number one concern. The fact that this patient is trying to remove the nasogastric tube, we need to evaluate if there is a need for us to apply restraints probably, or any other approaches so that we prevent injury in the situation. Okay, so the answer is going to be letter D. That's the correct option. And Yoshika, okay, congratulations for picking the correct option. You're the first one, I guess, who put letter D. We also have other people who put letter D as well. Claire, Fressel, okay, Helen also. So everyone in the NCLEX, I will tell you, okay? It's not always airway, breathing, and circulation. Safety is also a priority. So in this situation, you don't have any airway issue, okay? But then what comes in the situation is more of a safety situation, guys. Now, why is it that letter A is not the answer? Letter A, painful leg vesicles, we will address that, but that is not as life-threatening or dangerous as someone who is trying to remove the nasogastric tube or delirium, okay? Your letter B, someone with a colostomy stoma that's slightly bleeding after surgery. Remember, go back to your basic content. After colostomy or ileostomy surgery, it is somehow expected that there will be slight bleeding of the stoma. There will be slight bleeding. But of course, you still have to go there and you have to assess, but that's not going to be the first patient that you have to look, okay, or you have to assess. Now, letter C, the 36-year-old with diabetes mellitus who refused a morning dose. Of course, that's something they have to look into as well. However, the priority is going to be letter D. Okay, the priority is going to be letter D. Your letter C could be a priority if it's a person who received insulin and refused food or breakfast because that can lead to hypoglycemia, right? But letter C is a different situation wherein the person refused the morning dose of insulin. Now, A, B, and C, you still have to look into the situations. However, letter D should come first. So congratulations for those. Safety is a priority, everyone, especially you have a situation which is your delirium. Okay? So remember that it's not always airway, breathing, and circulation. Safety is also number one concern. Okay, so I hope that you learned something in that question, everyone. I think we have different answers in that question, but hopefully you learned something. Okay, so the goal of this program is not to memorize answer, but the goal of this program is to change the way you think. Okay, to change the way you think and to develop your critical thinking, everybody. Let's go to number 2 question, everybody. Okay, all right. So number 2, 4 clients push the call light at the same time. Which client statement requires the most immediate attention? A, I am feeling lonely and bored being by myself in this isolation room. B, the nursing station is very noisy and I want to be transferred to another room. C, I have been pressing the call light and the nurses are not answering immediately. D, my roommate screamed at me and does not want me to be here. Okay? Again, very simple question. And usually in the NCLEX, these are the kinds of questions that you receive. Very direct to the point. 4 clients push the call light at the same time. Which client statement requires the most immediate attention? A, I am feeling lonely and bored being by myself in this isolation room. B, the nursing station is very noisy and I want to be transferred to another room. C, I have been pressing the call light and the nurses are not answering immediately. Or D, my roommate screamed at me and does not want me to be here. Okay, who do you think is going to be the priority? Okay, among these 4 patients, everyone. And please put your rationale too so that your classmate can see that. Okay, wow, we have different answers in the situation. Okay, which patient or which situation needs to be addressed immediately? Which situation needs to be addressed immediately, everyone? Okay. Okay, which situation? And you will have these situations usually, okay, for patients pressing the call light. All right. So which client statement? Okay, everybody, you have 5 seconds to put your final answer. 5, 4, 3, 2, 1. Okay. So let's see what will be the priority, everyone. Okay? All right. So let's have the answer to this question, everybody. Okay, so you have different situations here. Okay, so the answer, everyone, to the question is going to be, all right, letter. Okay, so that would be letter D, everyone. Okay, so why is this letter D the answer, everybody? D is the answer because the patient said, my roommate screamed at me and does not want me to be here. The fact that the roommate screamed at the other patient and tells him or her that she does not want her or him to be in the room together, we have a situation. So this is endangerment, everyone, a safety issue again. So have you noticed the focus of our lecture for tonight is all about safety? Am I right? So letter D could be a case of resident-to-resident altercation, and I actually have a personal experience with this with my patients before. So whenever your patients, especially in this situation wherein you have a tense situation, you have to ensure the safety of the other patient. The fact that this patient says does not want me to be here. I think Carrie Ann is the first person or student there who commented letter D is the answer. So congratulations to you answer, guys. Okay, so Carrie. So the answer is going to be letter D. Your letter A, I am feeling lonely and bored being by myself in this isolation room. Is that a sign that this patient is in severe danger? Is this patient going to commit suicide? It is not. It's expected somehow that when the person is in the isolation room, you will feel bored. Okay, that's a reaction, feeling lonely. So you can address that. You could explore further. Or maybe provide activities, but it's not something as dangerous as letter D, the situation. Okay, but definitely that has to be addressed. Okay, unless it's a patient who has major depression and then the patient says, I want to kill myself, I want to put a bullet in my head, then that's a different situation, of course, because those are signs of indications of possible suicide, right? Now, your letter B, the nursing station is very noisy and I want to be transferred to another room. Not as important as letter D. Your letter C, I have been pressing the call light and the nurses are not answering immediately. That's also important, especially if your patient wants to go to the bathroom, full precaution. But still, letter D is the first answer. You have to investigate further. And what you have to do probably is to separate those two patients. Okay, separate them because it's going to be patient safety. Okay, so let's see some of the comments that you have here. So we have Yoshika said that D is the one at risk for injury. So that's exactly correct, Yoshika, why you answered letter D. So I hope that you learned something tonight, everyone. Okay, again, in the NCLEX, it's not always airway, breathing, and circulation. Safety is also a priority, everybody. Okay, something that you need to do right away. Okay, so very good. Okay, so all right, so let's go now to our next question. It's going to be on delegation, everyone. Okay, all right, so next question, everybody. So I hope that you have learned something in those two questions. How to analyze questions properly. Okay, sometimes it's airway, sometimes it's breathing, sometimes it's circulation, and sometimes it's really safety that comes in. Okay, so let's go now to the next one. And also, just before I proceed, just always remember this: when you answer questions in the NCLEX, you really have to read the situation very carefully and visualize yourself as a nurse in that situation. Okay, so sometimes you need to put yourself in the situation and see how you will be responding. Okay, so let's go to the next one. So which client should be assigned by the charge nurse to a new graduate registered nurse? A, the 34-year-old client who returned with a nephrostomy tube after removal of kidney stones. B, the 43-year-old client who needs daily wound irrigation of a stage 4 sacral ulcer. C, the 26-year-old client who is placed on a ventilator due to acute respiratory distress syndrome. Or D, the 51-year-old client who needs frequent neuroassessment due to a basal skull fracture. Okay? Again, Which client should be assigned by the charge nurse to a new graduate registered nurse? A. The 34-year-old client who returned with a nephrostomy tube after removal of kidney stones. B. The 43-year-old client who needs daily wound irrigation of a stage 4 sacral ulcer. C. The 26-year-old client who is placed on a ventilator due to acute respiratory distress syndrome. Or D. The 51-year-old client who needs frequent neuro assessment due to a basal skull fracture. So which patient is that going to be? Okay, so I think everybody's putting their answer. You have 10 more seconds to put your answer. And I like the rationale that you're putting, everyone. Okay, so the answer to this question, guys, is going to be yes. You got it right, everybody. That's going to be letter B. So letter B is the answer because, number one, we said that you're delegating, it has to be within the scope of practice. And at the same time, that has to be a stable patient. Now, what you notice in this question, letter B, is a patient that is most stable and at the same time is within the scope of practice of the registered nurse, new graduate registered nurse. Okay. Now, why is it not letter A? Well, always remember that all of these patients, A, B, C, D, all of this are within the scope of practice of the registered nurse, within the scope of practice. But then this is a new graduate. So you have to choose the most stable patient for this new graduate nurse. So you cannot have letter A because of the fact that this patient just returned after surgery, and then the patient has a nephrostomy tube. So you need a more experienced registered nurse for that. Your letter C is a patient who is placed on ventilator, acute respiratory distress syndrome, so that needs also an experienced registered nurse. Your letter D, the 61-year-old client who needs frequent neuro assessment, skull fracture, it needs an experienced also registered nurse. So those A, C, and D are the most unstable patients. So letter B is the best answer because that is more stable. So basically, number 3 is an RN question. Number 3, this question is for the NCLEX-RN. Okay, NCLEX-RN question. All right, so congratulations, everyone. Most of you got the correct answer. I think that we have some rationals here. So Macon, Econ Boncolmo said B because this nurse is able to do wound irrigation and the patient is stable. Very good. Okay. All right. Okay. So let's go to the last question for tonight, everyone. And I hope that you're learning something even for a short time tonight. Okay. So let's have the next question. Delegation. Now, this is a question for the NCLEX-RN or maybe for the NCLEX-PN. Okay, so which client should be assigned by the charge nurse to a new graduate licensed practical nurse? A. The 24-year-old client with type 1 diabetes mellitus who has acetone breath and Kussmaul breathing. B. The 41-year-old client with liver cirrhosis who has a sense taken Blakemore tube inserted. C. The 63-year-old client with Alzheimer's disease who needs intermittent tube feeding administration. Or D. The 52-year-old client with leukemia who needs laboratory monitoring for thrombocytopenia. Okay? Again, which client should be assigned by the charge nurse to a new graduate licensed practical nurse? A. The 24-year-old client with type 1 diabetes mellitus who has acetone breath and Kussmaul breathing. B. The 41-year-old client with liver cirrhosis who has a sense taken Blakemore tube inserted. Letter C. The 63-year-old client with Alzheimer's disease who needs intermittent tube feeding administration. Or letter D. The 52-year-old client with leukemia who needs laboratory monitoring for thrombocytopenia. Okay? Again. All right, so which client do you think? So I would like to say hi to Menchi, Grace Dalida, okay, Azamati also, Darla Garcia, Shane. Thank you for being here tonight. Melissa, Loretta, Green Astrid, Abidemi Sola, okay. Also Uche. So which patient? Welcome, Rich, John, Hannah, Ricardo. Welcome here tonight. Okay. So the answer to this question, you have like 2 seconds to put your final answer, guys. Okay. 5, 4, 3, 2, 1. Okay, so the best answer is going to be, so in this question, guys, who do you think will be the priority? Okay, or not really the priority, but someone that you can assign to a new graduate licensed practical nurse. Okay, so again, you have to choose the client who is the most stable in this situation. So the answer to this question, everyone, is going to be, okay, the answer is going to be letter C. Very good, guys. I think most of you get the correct answer. Yoshika Singh, thank you very much for your rationale. A, B, and D needs to be monitored and are not stable and is under the scope of practice of LPN and stable from the rest of the clients. Yes, Yoshika, very good. So which client? That will be letter C because the patient is more stable. And of course, intermittent feeding administration is within the scope of practice of the LPN. Even if your Alzheimer's disease patient has dysphagia, but still, um, it's much easier to give tube feeding compared to the other types of clients in this situation. Your letter A in this situation, everyone, your letter A, 24-year-old client with type 1 diabetes. Now, you have to go back to your basic concept. What does it mean if your patient has acetone breath or fruity acetone breath and cosmal breathing? That is your diabetic ketoacidosis, which is a complication of diabetes, right? And that means that your patient is unstable in letter A, all right? It has to be a more experienced nurse for letter A. It has to be the RN. Letter B, someone with liver cirrhosis, of course. But then, what makes letter B unstable? The fact that you inserted Sangstein-Blakemore tube. What is a Sangstein-Blakemore tube again? It is a tube that is inserted for a patient with liver cirrhosis who has bleeding esophageal varices. So meaning that your patient is unstable in letter B because management of the Sangstein-Blakemore tube should fall under the care of a registered nurse, right? Now, letter D, someone with leukemia who needs lab monitoring for thrombocytopenia. Now, lab monitoring, evaluation, interpretation, all the lab monitoring should be responsibility of the RN. Because remember, we do not delegate EAT, evaluation, assessment, and teaching. So letter D is more about evaluation, monitoring the labs, and interpretation is the responsibility of the registered nurse, everyone. Okay? All right. So the answer is going to be letter C, everyone. So do you need more time to answer, guys? Well, usually when I see everybody's answering already, but we'll give more time later on, okay? But anyway, the answer is going to be letter C in this situation, guys. Okay? So letter C. So let's see. Okay. So before anything else, I would like to plug in our program, guys. Okay. So Vibrant said, or Diane said that time is so fast. Okay. So, but anyway, oh, time is so fast. You mean that we're almost done? Yes. So next time we will try to have more questions, guys. Okay. But again, so put your scores, everybody. So we have the online NCLEX Academy, everyone. The Matus Nursing Review online NCLEX Academy. So we have the self-study program, and we also have the 10-day live webinar every Saturday. Later on, we will also announce if we have a classroom lecture already. So we're trying to find a classroom right now. And once we have the go signal as well, then we can do the classroom back again. But for now, we have the self-study comprehensive online NCLEX review that comes with a workbook, and at the same time access to the online NCLEX review with all of my lectures. And at the same time, you will see in the online NCLEX Academy all of our sessions for our Facebook Live, delegation, and prioritization. Okay? And of course, you have a lot of other resources as well in the online NCLEX Academy. We have our quizzes, short quizzes after the end of lessons. All right? Okay, so, and then another one, we have our merchandise, everybody. So think positive all the time. We have our tumblers, our shirts, sweatshirts, and I know that a lot of students have bought our products, and thank you very much for your support, everybody. Getting the word out there to help other nursing students too. And always remember, they have to think positive. So far, our best seller is this Tumblr, and I'm really very happy about that because a lot of students really like this, and they have been sending me pictures also using this Tumblr in their workplace or also in the gym. So always remember, I can do it. So think positive. Okay, I think we call that the law of attraction. Then also for last week, congratulations to Arnie Doms Oliver. He is the one who won our 90-day online free NCLEX review. Okay, so give our congratulations to Arnie Doms Oliver, everybody. And also, if you pass the NCLEX, please let us know so that we can give you a shout out or congratulations in this program, everyone. And I hope that you learned something for tonight. We're gonna look at some of the comments. Okay, so we have okay, a lot of good comments here. Okay. Oh, you like my new eyeglasses? Looks very good on me. Thank you very much, Loretta. Yes, these are new glasses. I got actually two glasses now. Okay, working very hard. But anyway, everyone, thank you very much. Next week, we're going to have more surprises and more announcements, hopefully, and new passers as well. I really like receiving those emails that you send, especially your testimonials and helping out students. Finally passed the NCLEX even several tries or even after graduating from school a long time ago, everyone. So thank you very much, everybody, and thank you for your support, and never give up. NCLEX is just around the corner. Okay, so do your best, everybody, and I will see you again next week. If you have any questions, put your questions in the comment section, or you can directly email or message us on Facebook. Thank you, guys.